a pathology report after the post-mortem examination on baby Ethan reveals that he died out of respiratory depression caused by the swelling of the brain due to alleged intoxication. Ethan died on Sunday at the Shalom Hospital in Machakos after he was injected with morphine, which was 20 times more than the recommended dosage for his weight. However, the conclusive report and the results will be released on the 21st of this month. Meanwhile, the Pharmaceutical Society of Kenya has stated that the person who dispensed the controlled drug was not a qualified pharmacist and the baby could have been saved if an antidote was administered in time. NTV's Eunice Omolo with that report.
At the Montezuma Funeral Home in Machakos, family and friends of 7-month-old baby Ethan Wendo anxiously await the post-mortem results of the young one who died after what is believed to be an injection of a controlled drug, morphine, 20 times the recommended dose for his age and weight, after sustaining a burn on the hand due to hot water from a dispenser at home. The findings of the test conducted this afternoon have revealed that there was evidence of reduced oxygen circulation caused by respiratory depression due to the swelling of the brain occasioned by intoxication.
The only positive finding we would say largely was in the brain, which appears swollen. The rest of the tissues are essentially normal. There's no evidence of injury or trauma to the head, the chest, or any other part of the body.
According to the Pharmaceutical Society of Kenya, the hospital lacked qualified personnel to dispense the controlled drug morphine as a painkiller or any other drugs classified as narcotics or opioids.
Place where, that lacked professionals who were able to calculate and say that this baby needs this. If that's the only medicine that's available, then at what dosage they require?
A drug classified as a controlled product that should be handled only by a qualified pharmacist who adheres to a professional code of conduct. Medicines are poisons and should be handled by the right professionals to provide benefit without harm.
Questions have also arisen if the baby really needed the strong painkiller for the scald on the hand and if perhaps his life could have been saved. The cardinal rule, according to the pharmaceutical body, is that the patient should be observed for any side effects upon receiving morphine treatment and an antidote given to aid flush the strong drug out of the system.
You must have the antidote called naloxone stocked in hospital and ready for use in case your patient develops side effects. Unfortunately, what occurred was that the patient was discharged after being given morphine. It doesn't seem like any monitoring was done, and even when the mother...
Too high a dose of morphine in the body causes undesirable side effects and if not curbed on time could be fatal. The toxicology, body fluids and tissues are to be submitted to the government chemist to establish chemicals present and in what ratios. The government laboratory will give the final examination results, upon which the hospital staff who are in police custody will be arraigned. The Shalom Hospital management has issued a statement expressing its regret over the death of Ethan, stating that it will fully cooperate with authorities as it conducts internal investigations. Operations at the hospital are to come to a close on Wednesday after being given 2 days ultimatum to close down. Eunice Omolo, NTV.